So that's about voices. Just finally to talk a little bit about negative symptoms. And negative symptoms are those symptoms which really take things away, that you've lost your motivation, you've lost your drive, almost lost the emotional content that goes with it as well. It's just very difficult to really sort of get the get up and go has got up and go on is the sort of classic way of thinking about negative symptoms. The ways we're working now is making sure medications are the right sort of level, because medication can do positive and negative things with negative symptoms. Managing these positive symptoms, the positive symptoms are things like the voices, like the beliefs that cause problems, because quite often these interfere with life. So things like what we call ideas of reference, the feeling that when you go out you're being talked about, can stop you going out. And so people stop going out. When they stop going out, that gets them more depressed. That can then reduce what they want to do, where they want to go, can actually make the beliefs worse. And so helping people understand these ideas of reference, understand these voices, and thought broadcasting, where they think that people are actually hearing what they're thinking. Telepathy, that sort of thing going on all the time, which can be very distressing and very intrusive. These are the sorts of thoughts which working with, giving people strategies to deal with, means that when they're ready to get started again and begin to go out, they're able to cope with them better. Being able to understand the symptoms, this formulation, making sense of what's happening to them, can give them the strength to be able to go out as well. And then particular techniques to manage, like the coping strategies we talked about, can be quite important. Depression, anxiety can affect this as well. If you feel down and low, that affects your motivation. If you feel frightened about going out and meeting people, that affects your motivation. So learning how to cope with that better is quite important. Perhaps more important even than that is just thinking about how sometimes what we think about as very negative, these negative symptoms, can actually be protective. And that sometimes pushing actually isn't the best way to deal with them. That sometimes sort of withdrawal can be quite an effective way of handling stress. So quite often people with these sort of problems, negative symptoms, tend to stay in bed in the morning and then get up late at night and stay up late at night. And if you think of a good way of avoiding stress, that's about the best in the world. You know, if I could avoid breakfast and getting up in the morning, when things tend to be quite chaotic, you know, and there's quite a lot of expectations around. You know, that's when people are going off to work, and that's when they're going to college. And if you're not well enough to do that, you can feel very negative about that. And you know, what's a nice quiet time of the day? Well, 1 o'clock, 2 o'clock in the morning, probably as quiet as any. Peaceful, understimulating. And so understanding that and then being able to work with that can be very important. And there can often be a fear that these positive symptoms are going to worsen. There's also this idea that quite often after someone's been very ill, they need a period of convalescence, they need a period to recover. And that quite often we're, with the best of intentions, trying to get them going. We want them out, we want to get them back to see friends again, get back to college, get them to work. And in fact, can sometimes not give them the time to recover. And even years down the line, sometimes they're still feeling under pressure to get going. The more pressure they feel, the less they're able to do things. And the less they're able to motivate themselves. And finding things that motivate are very important. But particularly, paradoxically, in a sort of strange way, assessing this pressure is one of the things we found very important. And there is very good research evidence for this as well. I mean, this may sound sort of, you know, at times we feel we do have to sort of persuade people that this is a reasonable thing to do. But understanding the pressure the person feels under, looking at their expectations, but often they're expecting too much of themselves at the moment. In the long term, it's perfectly reasonable to be looking at having a girlfriend, having a job, living independently. But that may be 4 or 5 years down the line. It would be better to sort of plan in that direction and say, well, actually, if you take a year off, we can do some work on the worries you have at the moment. You can begin to get back in control of your life and feel in control of it again. That may be the best way to do that. And we often find that actually reducing activity for a little while actually paradoxically has a positive effect. And this can take a little bit of selling, and it needs individually negotiating, but has often proved really quite successful. We've got somebody who is having real difficulty getting into a day unit, trying to get in at 10 o'clock in the morning, just not getting there. When we said come in at 4, she managed that. And she felt that that actually took the pressure off, so she didn't have to push in the morning. And that, in fact, led to her being quite motivated and moving on to quite a lot of other things. So what we're aiming at is certain goals. I'm trying to do that, but what's actually happening is that. You just keep on getting demoralised and bouncing off the bottom. And that's not a successful way to achieve what you're aiming to do. So slowing things down before you aim to reach up, even doing a little bit less for a little while, may be the best way to reach the goals that somebody's after. And this is the sort of thing that we're negotiating with carers and with individuals in a sort of CBT setting. You can't push people out of negative symptoms, and that's a key thing, is that the more pressure the person feels, the less motivated they actually appear. What you may be able to do is help them in their own time to find the doors to go through. And that's the sort of principle of what we work on. Now, one of the things that we do have an issue about is terms and how we use information, how we talk about it. This was a photograph taken by Dr. recently, and some of the things that this person talked about were really quite important, quite relevant to this talk. That she talked about it being a taboo subject. Taxi driver says, "What's wrong with you? I've got schizophrenia." "No, you haven't. Tell me you haven't got it." So I don't talk it out, or they may take it the wrong way. What's very clear now is we do need to be able to talk about these issues. But we do also need to have a language which is helpful with this. And increasingly we're thinking about, well, what's the best way to talk about this? And we're using terms which talk about sensitivity, because quite often a large group of people are very sensitive to stress for whatever reason at that time in their life. And sensitivity is quite a useful way of thinking about it. Trauma for some people, drug-related illness for others is important. Severe anxiety may be appropriate to others. And that we need to start to think a little bit more about how we use terminology that's effective and helpful with the aim of trying to reduce distress and disability. And that's really the overall aim of what we're working on. So that's really a sort of, in a nutshell, what we're talking about when we talk about CBT. Obviously there's more to it in terms of what a therapist might do, but those are the key elements and the key issues.